Welcome to Power Snack, the short-form segment of the Power Edge by BSD Business Consulting. I'm Katie. This week's quick insight is coming up next. Hospitals are becoming AI power plants. Not literally, of course. No one is saying the emergency department is about to start selling electricity back to the grid. Although, with the way healthcare costs are set up, give it 5 minutes and someone will try. But the point is serious. Hospitals are no longer just buildings where care happens. They are becoming data-heavy, AI-supported, always-on critical infrastructure environments. And that changes the power conversation completely. For years, hospitals have already depended on complex electrical systems, emergency power, backup generators, automatic transfer switches, UPS systems, imaging equipment, life safety systems, operating rooms, labs, pharmacy automation, patient monitoring, nurse call systems, and building controls. That was already a lot. Now add artificial intelligence, add robotic-assisted surgery, add AI-supported imaging, add predictive analytics, add remote monitoring, add digital command centers, add more connected devices, more sensors, more servers, and more local compute. Suddenly, the hospital is not just treating patients, it is processing enormous amounts of data in real time. And that is where edge computing comes in. Edge computing means moving computing power closer to where the data is created. In a hospital, that may mean more on-site servers, more upgraded data closets, more server rooms, or even hospital-based micro-data centers that support clinical systems closer to the point of care. Why does that matter? Because some healthcare workflows cannot wait for data to travel back and forth across distant cloud infrastructure. If a hospital is using AI for imaging, robotics, monitoring, or real-time decision support, latency matters. Reliability matters. Uptime matters. The power behind the system matters. That is why the phrase "the cloud" can be misleading. A hospital may use cloud services, but the infrastructure still has to exist somewhere. And increasingly, part of that infrastructure is being pulled closer to the hospital itself. That creates a new challenge. Hospitals that want to compete on technology, patient experience, speed, accuracy, and advanced care are going to need stronger infrastructure underneath the software. Because healthcare is a mission-driven field, but hospitals are also businesses. They compete for patients. They compete for physicians. They compete for funding. They compete for rankings, reputation, service lines, specialty programs, and technology leadership. No hospital wants to be the one saying, "We would love to use more AI, but our electrical infrastructure cannot support it." That is not a technology strategy. That is a bottleneck. As hospitals add more AI and robotics, they have to ask harder infrastructure questions. Can the electrical system support the added load? Are the data closets and server rooms designed for higher power density? Can the cooling system handle more heat? Are the UPS systems sized correctly? Are the generators and transfer switches ready for the next phase of demand? Are clinical teams adding technology faster than facilities teams can support it? That last question matters, because in many organizations, digital transformation moves faster than infrastructure planning. The software team wants to deploy. The clinical team wants better tools. The executive team wants innovation. The facilities team is left asking, where exactly is all this power supposed to come from? And that is the part people miss. AI in healthcare is not just an IT upgrade. It is a facilities issue. It is a power reliability issue. It is a cooling issue. It is a capital planning issue. And in hospitals, it is also a patient safety issue. ECRI has already identified AI chatbots as one of the top health technology hazards for 2026, and also warns about risks tied to system outages and technology failures. That should get attention, because the more hospitals rely on digital systems, the more infrastructure failure becomes operational risk. So the real question is not just, can hospitals adopt AI? The better question is, can hospital infrastructure support AI safely, reliably, and at scale? Because the hospitals that move early will not just be buying better software. They will be upgrading the physical backbone behind it. More power capacity, better cooling, stronger backup systems, smarter data closets, more resilient server rooms, earlier coordination between IT, facilities, engineering, and capital planning. That is where the opportunity is. The next generation of healthcare will not run on AI alone. It will run on power, cooling, uptime, and infrastructure that was planned before the crisis. Hospitals are becoming AI power plants. The ones that understand that early will be better positioned to compete, scale, and protect the systems patients are depending on. This has been Power Snack, a short-form segment of the Power Edge by BSD Business Consulting. If your organization is planning around AI, robotics, higher density compute, or critical infrastructure upgrades, start with the question most people skip. Is the infrastructure ready?